my head to toe assessment. Claire here has given me her permission to use her as the patient so I can submit this for grading. Okay, first thing I'm going to do is I'm going to collect all my supplies. It's going to include the tongue depressor, it's going to include the stethoscope, pen light. I'm going to come into the room and I'm going to first I'm going to hand hygiene, and then I'm going to pull the curtain for privacy. After I've pulled the curtain for privacy, I'm going to introduce myself. Hello, Claire. My name is Nate. I'm
Hi,
a
Nate.
student nurse today. I'm here to perform a head-to-toe assessment.
Okay.
Do I have your permission to proceed?
Yes.
Great. Okay, once I've gotten permission to proceed, I'm going to, once I have permission to proceed, okay, next I'm going to, sorry about that.
That's okay.
Next I'm going to ask your date of birth and your name.
Claire Hughes, XXXX.
Okay, thank God I remember that. Okay, yes, thank you for that.
Of course.
At this point, I'm going to make sure that the client is sitting at the edge of the bed. I'm going to look around the room, make sure that the room is free of hazards. Next, what I'm going to do is I'm going to ask the patient if they know where they are. Do you know where you're at today?
I'm at NAU.
Great. And then I'm also going to ask them about what day it is today.
It's Tuesday.
Perfect. Okay. So the patient is alert and oriented times 3. That is name, place, and time. So now that we've done that, I'm going to visualize. I'm going to inspect that they are calm, that they are well kept, that they are alert and responsive to questions. From here, we're going to start off with the head, face, and neck assessment portion. First thing I'm going to do is I'm going to visualize the patient. I'm going to look at their head. I'm going to vocalize that the head is normal cephalic in shape. The face is symmetrical. The neck is proportionate to the head and the face. At this point, I'm going to ask the patient if I can palpate the scalp to look at hair distribution and see if there's any lumps or bumps or tenderness. Is that okay?
Yes.
Great. So I'm going to come through here. I'm going to fill around. I'm going to move some hair around, make sure that I'm not missing anything. And the hair is distributed normally. So from this point, I'm going to I'm going to look at the patient, ask them to look up. I'm going to look at the trachea, and the trachea is midline. I'm going to move into the lymph and at this point I'm going to bear with me a second. It's a lot of information. Next, we're going to do the temporal and the carotid assessment. So I'm going to, I'm going to go ahead and check the temporal arteries. And next I'm going to assess the carotid artery one at a time. Here it is. And we're going to do the left side. There it is. Okay. Temporal and carotid arteries have been palpated, or palpable bilaterally. Next, we're going to check the lymph nodes, and so I'm going to go ahead and check the jawline. We're checking for any lumps. We're also checking for any pain or tenderness. Do you have any of that?
No, sir.
Okay, we're going to go ahead and move back. We're going to go around the ears here again. Any pain or tenderness?
No.
Great. Lymph nodes are non-palpable and non-tender bilaterally. Okay. Next, we're going to start the eyes section of the assessment. If you can for me, can we do this with your glasses removed, please?
Sure.
Great. With the eyes, first thing I'm going to do, I'm visualizing, making sure they look symmetrical. We're going to check the patient's field of vision. So I'm going to use my pen light. I'm going to ask the patient to look at the pen and go ahead and follow the pen with just your eyes.
Okay.
Go up, go down, cross. We're going to do left, right. Okay, great. I'm going to state that EOM is intact and no nystagmus is noted. Next, we're going to check the pupils for dilation. So I'm going to use my pen light here. Go ahead and just stare forward, and I'm going to put a little bit of light in your eye. Check the right side, the left side. We're going to do this again, but look at the other pupil. Very good. Very good. Okay. Next, we're going to I'm going to have you take a look at the pen, and then I want you to look past the pen back at the curtain.
Okay.
And we're going to do that a couple times. So look at the pen, look past the pen, look at the pen, look past the pen. Great. Looks good. Okay. So pupils are perla. So pupils are equal, round, and reactive to light and accommodation, both direct and consensual. Okay, I believe that's everything with oh, and then go ahead and take a look, and it looks like pupils are 3 millimeters bilaterally. Awesome. Okay, so next we're going to move to the ears.
Okay.
Okay. With the ears, we're going to check. First thing we're going to do is we're going to push on the tragus for pain or discomfort. Is there any pain or discomfort?
No.
No. And then we're going to pull on the pinna a little bit. Ask again, pain or discomfort?
No.
No. We're going to do the other side here. Pain or discomfort?
No.
No. And pain or discomfort?
No.
No. Okay. Ears look good. They are symmetrical. symmetrical, but your nose is midline. Your nares are symmetrical. And your nares are symmetrical. And and breathing is noted bilaterally. Okay, so next we're going to go ahead and we're going to assess the mouth.
Okay.
So what I'd like you to do is to go ahead and open your mouth, and I'm going to shine my light. I'm going to look at the roof of the mouth. I'm going to look at the sides of the mouth. I'm looking at the tongue. Go ahead and stick your tongue out for me. At this point, I would depress the tongue, and I would have the patient say ah. Okay, great. Uvula rises with phonation. Both the tongue and the buccal mucosa is pink. It is moist. It is free of lesions, and okay. At this point, I want to take a step back. I don't really want to redo the whole video, but what I am going to ask Claire to do is I'm going to ask you to take your glasses off for me, because I did forget a step here, so I want to make sure to record that. With the eye assessment, what I'd like you to do is you're going to pull down your lids a little bit and go ahead and look up. Okay, thank you for that. Conjunctiva was pink and moist. Sclera was white. No signs of jaundice or drainage bilaterally. So I know this is a little bit late in the video, but I wanted to make sure that I addressed it. Okay, so at this point, we're going to, I'm going to go ahead and have you sit into the bed.
Okay.
And we're going to start with breaths and thorax.
Okay.
Okay, so go ahead and.
Do you want me backwards?
Yeah, just go ahead and, yeah, there you go, thank you. I'm just gonna make sure that this is all the way down. I have visualized breath respirations as normal and non-labored. At this point, we're going to go ahead and we're going to work in the posterior thorax, and I'm going to put my hands on Claire's back, and I'm going to ask her to take a couple deep breaths. Go ahead and do one more for me. Okay. Posterior thorax rises and falls symmetrically. Also at this point, because of this assessment, we have clothes on, but usually this would be, there'd be open skin, so I would also, excuse me, I would also assess condition of skin. In this case, I would say, skin is consistent in color, normal, and intact. Now what I'm going to do is I'm going to go ahead and I'm going to listen for breaths posterior thorax. Claire, what I'm going to do is I'm going to put the diaphragm of my stethoscope on a few different spots on your back.
Okay.
And if you can take deep breaths for me when you feel the stethoscope touch your back, that would be helpful.
Okay.
Great. Okay, we're gonna start. Right side. Take a breath for me. Great. Thank you for that. Breaths sound uh, breaths sound clear, um, and breaths sound clear and are and no adventitious breathing is noted. At this point, posterior thorax is finished. We're going to go ahead and move to the anterior. We're going to go ahead and move to the anterior thorax. So patient is going to be facing me. I'm going to basically do the same thing on the anterior side here. Okay. Take a breath for me. Okay, again, breath is clear, and there's no note of adventitious breathing. Now that we've done the posterior and the anterior thorax, now we're going to go ahead and move to heart sounds.
Okay.
So just to explain a little bit, we're first going to assess the heart sounds with the diaphragm of the stethoscope,
Okay.
and then we are also going to do the assessment with the bell of the stethoscope, and I'll explain what those means afterwards.
Okay.
Great. Okay. First assessment is the aortic valve, which is second intercostal space, right sternal side. Next, we're going to move to the second intercostal space, left sternal side, the pulmonic valve. We're going to move down to the third intercostal space. This is left sternal. This is Erb's point. We're going to move down to the fourth intercostal space, left sternal. This is the tricuspid valve. And then I'm going to ask Claire to pull up her breast tissue, and I'm going to check the fifth intercostal space, mid-clavicular line for the mitral valve. Normally I could listen for 1 minute, and that would give me your apical pulse rate. Okay, great. So I'm going to move a little bit quicker here, but again, just to walk you through it, we're going to go ahead and do everything that I just did, but now we're going to do it with the bell. This is going to help me assess your S3 and S4.
Okay.
Okay? So again, we're going to do my collarbone. It's the second intercostal space. highlight that the S1 and S2 was auscultated with the diaphragm of the stethoscope, and the S3, S4 was auscultated with the bell of the stethoscope with no murmurs noted.
Okay,
Okay.
thank you.
Yeah. So from here, we've finished the heart, and we're going to go ahead and move to the abdomen. So I'm going to go ahead and have the patient go ahead and lay down on the bed for me. And okay. So from the abdomen, first thing we're going to do is we're going to use our pen light, and I'm going to shine the pen light 2 different angles of the abdomen here, and I'm going to note that the abdomen is flat, and that it is also it's flat, and there's no pulsations and no bulges. And after we note that, we're going to go ahead and start working with the 4 quadrants of the abdomen. First thing I want to do is I want to check the first thing I'm going to do is I'm going to auscultate the right lower quadrant. I'm going to make my way to the right lower quadrant, then the right upper quadrant, then I'm going to the left upper quadrant, and then the left lower quadrant, and I'm going to auscultate this with the diaphragm of my stethoscope. Normally, I would listen to the sounds for a minute in each quadrant, but for the sake of this video and the time, I'm going to speed it up a bit. But I will vocalize what I'm doing. Okay, first thing I'm going to do. Now I'm moving to the right upper. Left upper, left lower. Okay. At this point, I have assessed, or I have auscultated the 4 quadrants. I'm going to note that noises, gurgles and clicking sounds have been auscultated. Next, I'm going to assess the 4 quadrants, but this time I'm going to palpate, and I'm going to begin. Okay. Great. So I'm going to go ahead and check in 3 different places.
Okay.
And I'm going to ask you about pain and tenderness as we go around the intestines.
Okay.
Okay. So first here, any pain?
No.
Any pain?
No.
Any pain?
No.
Up here?
No.
Okay. Left?
No.
No. No. And then left lower?
No.
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 No. And no. Perfect. Okay. Patient has noted that there is no pain or tenderness in any of the quadrants that I've palpated. So palpation was free of pain and non-tender bilaterally. Yes. Okay. I think that's good there. So
Okay.
at this point, I would bring the bed up. It's already in position, but and just another point that I I need to backtrack on. Sorry about this. When I did have Claire lay down in the bed, I should have brought her. I should have brought her head down into a flat position. I didn't do that, but I am noting that after the fact. And then since the head was already up, at this point I would be bringing the head up. So from here, we're going to go ahead and oh, you know what? It's not that time yet. Claire, if you can go ahead and move back into the bed. I have a few more assessments that I need to do. Sorry about that.
You're fine.
Okay, great. So at this point, I am going to actually move her into more of a upward seating position. Let's see here. Are you okay with that?
Yes.
Okay, great. So at this point, if the patient has like a blanket or anything on them, I'm going to remove the blanket so I can have access to the patient. I am going to look at their skin, whether it's arms. Again, there would be a lot of this assessment that was being done on the skin, like diaphragm on skin, checking for skin color. Obviously, we can't hear, but from what I can see on the arms and the legs, skin color is intact, or skin color is not intact. Skin color is consistent. The skin integrity is intact, and I'm going to go ahead and palpate Claire's arms here, and then I'm also going to palpate her legs, and I'm checking for edema in the upper and lower portions of her extremities, and no edema is noted in the upper and lower extremities. From here, so I assess skin, assess edema. At this point, I'm going to check your radial pulse and your dorsalis pedis pulse.
Okay.
Okay, so if you can go ahead and give me your wrist here. I'm going to start by checking this first. There we go. I'm going to check thumb side. Nice pulse. We're going to go ahead and do the same on the feet. Very good. So from here, I'm going to go ahead and hand hygiene, and I'm going to observe that both the radial and pedis pulses were palpable, and that strength is 2+. Okay. So what we're going to do now is we're going to go ahead and do some wiggling of the extremities. So Claire, if you can wiggle your fingers for me, looks good. If you can wiggle your toes for me, looks good. What we're going to do now is I'm going to ask the patient to close her eyes, and I'm going to touch a couple different spots on her left or her right side, and then she'll just tell me left or right from whatever side that I'm touching. Okay, Claire, I'm going to start. What side is that?
Right.
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 Left.
Left. Okay. So patient has verbalized which side is is palpable with eyes closed. From here, we're going to go ahead and so we did fingers, we did toes. Okay, bear with me for just a second. I want to make sure I'm not forgetting anything. I think that's everything. Okay. I feel like there's something else, but I can't remember. Okay, Claire, at this point, I'm going to go ahead and have you sit up for me, and thank you for allowing me to do that portion of the assessment. From here, I'm going to ask that you stand, and I'm going to go ahead and do the next round of assessments, if that's okay. Great. I'm going to move this out of the way just so the camera can kind of see what's going on here. Make sure that we're in view. Great. First thing we're going to do is I'm going to palpate joints. So I'm going to check shoulders for pain or tenderness.
No, I haven't.
No.
No.
No. That's on the elbow, on the wrist.
Nope.
No. And then we're going to check for pain and tenderness on the lower extremities, hips.
None.
Knees.
No.
None.
None.
Okay, that's good. Okay, so upper and lower extremities free of pain and non-tender bilaterally. Next, we're going to do range of motion. So I'm just going to have the patient here follow my lead. Okay.
Okay.
So, thank you. First thing we're going to do is we're going to go ahead and look up, and we're going to look down. We're going to look to the left, and we're going to look to the right. We're going to grab our arms, we're going to bring them up, bring them all the way up. Great. We're going to bring those all the way down. Go ahead and turn your wrists for me, and bring your arms to your side. What we're going to do here is we're going to do biceps up. We're going to turn into T-Rex arms and bring them back down. Next thing we're going to do is we're going to assess the lower extremities now. So go ahead and lift up choice of your leg. Thank you for holding on. Go ahead and bring your leg out. Point your toe for me and dorsal flex. Okay, go ahead and put your leg down. We're going to do the other leg, leg up, forward, point the toe, dorsal flex, and back down. Good range of motion. Next, what we're going to do is we're going to do all those range of motions that we just did, but now we're going to do it against resistance. So first thing we're going to do, you did look up, so I'm going to go ahead and put a little pressure. Go ahead and try to look up for me. Good. And then go ahead and press down. Good. Go ahead and look that way. Good. The other way. Great. We're going to bring our hands out to the side now. Good. Go ahead and bring your arms forward. Nice. And then go ahead and pull them back. Very good. What did we do? Okay, go ahead and do bicep curls, and then go ahead and push against me. Very good. Okay, so upper extremity range of motion is strong. I'm going to go ahead and have the patient sit on the bed so we can so we can check resistance for the lower extremities. Okay, from here, go ahead and move your legs one at a time for me. Okay, very good. Go ahead and move that, very good. With your feet, go ahead and move your feet up one at a time, very good. Go ahead and keep your foot up for me, and go ahead and push down, very good. Okay, patient shows strong reflexes, and patient shows strong balance. Patient has good balance and strength. That's what I got. Okay, next what we're gonna do is we're gonna check your reflexes, okay?
Okay.
So I'm gonna use my stethoscope here, and I'm going to tap your knees and see if we can elicit a response.
Okay.
Okay. Oh, that's the bone. Sorry about that, Claire. There we go. Yay! We're gonna do the other one. Not hit the bone this time. There we go. Okay. So patient did elicit a response, 2+. Okay. So now, now that we've done reflexes, just trying to think, reflexes. Oh, next we're going to go ahead and check a gait. So I'm going to go ahead and have Claire stand up for me. Go ahead and take a couple steps this way for me. Okay, turn around and go ahead and go back towards the bed. Great. Okay. Patient ambulates independently, and balance is good. Okay, at this point, our head to toe assessment is finished. It was a lot harder than I thought it was going to be. From here, I'm going to have the patient go ahead and sit back in the bed. Go ahead and get back into a position that's comfortable for them. So just so I can walk through it, Claire, if you can go ahead and lay back for me. Bed is still all the way down. I'm going to bring up the side rails. I'm going to tell the patient that I'm going to document all the findings, and that I will return to check on them shortly. I'm going to give the patient a call light, and that's it. Thank you.